Select Committee, Jeremy Hunt.
Madam Deputy Speaker, to reorganise the NHS as one of your first acts as Health Secretary is what Sir Humphrey would describe as brave. But I am supporting this bill because it contains changes that the NHS has asked for. I take the Secretary of State at his word that there is more to come on social care, and he has said he will pursue the idea of independent inspections on safety and quality of the new ICSs to make sure they are outward-facing and focused on the needs of patients. But when it comes to the biggest challenge facing the NHS today, which is workforce gaps, this bill says little or nothing. Independent forecasts today say that we are currently short 400 psychiatrists, 1,400 anaesthetists, 2,000 radiologists, 2,000 midwives, 2,000 to 2,500 emergency care consultants, 2,500 GPs. We have more nurses, but we are short of learning disability, mental health and community nurses.
On GPs, will you give way?
I give way to my honourable friend.
It's unquestionably that we have a challenge with the GP workforce. Would he agree that we have a big challenge from constituents with access to general practice? It's about the numbers, yes, but it's about access, and right now we don't have the balance right between telemedicine and in-person medicine.
There is a big issue, and the root cause of that issue, which is something that he was very aware of from his time in the Department of Health, is capacity in the system. And these capacity issues taken together are why the Health Foundation says that within just over a decade, we risk a workforce gap in the NHS of around 500,000 people. And this is why this is such a big issue. And I urge the Secretary of State to think about that as he takes this bill forward. Now, what I would say, yes, I give way to my honourable friend.
Thank you for giving way. Would my honourable friend agree that this is also the case for stroke victims and rehabilitation services, that the vital link between those who are occupational therapists, physios, and not having the proper workforce in place for at-home care after a stroke?
She is absolutely right. These issues are not just about doctors, they're about all associated health professionals, allied health professionals, and indeed the social care workforce. But it's very important to note that they predate the pandemic. And that's why when I was doing my right honourable friend's job, I set up 5 new medical schools and increased the number of doctor, nurse and midwife training places by a quarter. But we need to go further. And when the number of people we train, the number of clinicians we train, is decided by haggling between the Department of Health and the Treasury in a spending round, there is always the risk that it will be eclipsed by more short-term considerations. But the truth is now we have a short-term emergency with workforce burnout. And that is why I urge my right honourable friend to look at the simple and sensible solution proposed by the Health Foundation and all the Royal Colleges in the Times today, which is to legislate for Health Education England to have a statutory responsibility to publish annual independent workforce projections across the health and care system for the next 5, 10, 15 and 20 years. That would also say how many training places are needed and start to tackle this problem and start to tackle the obscenity of £6 billion spent every year on locum doctors and agency workers, which cannot be the best use of funds. Madam Deputy Speaker, frontline health and care workers are exhausted. They know there is not an instant solution to these issues. They know it takes 3 years to train a nurse, 7 years to train a doctor. But we can at least give them the reassurance that there is a long-term plan in place. At the moment, this is not in the bill. It needs to be in the bill. And after the dedication that we have seen from health and care staff over the last year, it is the very least we owe them.